Alberta Primetime with Michael Higgins.
Welcome to Alberta Primetime. Ahead tonight, our politics panel on healthcare workers accepting a new deal. But first, paving the way to a dual practice system.
Alberta patients will continue to receive care through a strong public health system, but will also have the option to purchase services they are currently waiting for.
In a bid to improve surgical wait times and attract more medical practitioners, the Smith government has introduced legislation allowing certain doctors to choose whether they bill a service to the province or a patient privately on a case-by-case basis. There will be no private options for emergency care, urgent surgeries, as well as cancer treatments. Family doctors will also be restricted from participating. So joining us now to pick up the discussion, Lorian Hardcastle, an associate professor in the Faculty of Law and Cummings School of Medicine at the University of Calgary. Dr. Hardcastle, good to see you. Welcome back.
Good to see you too. Thanks for having me.
All right, so how much of a fix is this for the frustrations many Albertans have with the healthcare system?
So I don't think it's a fix for the overall system. I think that, sure, for the person who is able to buy services and there is a physician willing to provide them, that person may feel happy with these changes. But for the overall system, it really isn't going to be a fix. And we can look at other places that have tried this, but the issue is that if you have a finite pool of doctors and they have some private patients, some public patients, the issue is those private patients may get seen faster, and the public patients who are on average going to be less healthy, more complex medical needs, those people may end up waiting longer and their conditions deteriorating as a result.
Now, based on what you've observed to this point, how prepared is the Alberta government to not only move this forward, but to do it successfully?
I don't think they're prepared. A lot of the legislation leaves the safeguards that will be in place up to ministerial order. There's not a lot in the legislation to try to preserve the public system, but rather it seems that we're just going to forge ahead. What I would have liked to see instead is us looking at other jurisdictions that do this, some of the safeguards they have in place to make sure that doctors are spending enough time in that public system treating public patients and considering what we might borrow from those places. But there isn't a lot of evidence that the government is planning on doing a lot in terms of those safeguards at this point.
How complex or convoluted a system might this end up being to navigate from a patient perspective?
I think it could be quite complex from a patient perspective. I think that, you may end up having difficult interactions with your doctor where maybe they're offering you a service quicker if you pay, and you may not know, well, should I pay? Should I not pay? And that kind of conflict of interest in that relationship. And then if you can't pay, how do you then go and find another doctor who could see you quicker without paying? And how do you navigate all of that? And then from a physician perspective, this will add complexity potentially to their lives as well if they opt in. Instead of just seeing patients and billing the government, they will be seeing patients, billing the government, billing patients privately, then collecting on those bills, potentially billing private insurers. So there could be a lot of administrative complexity. And then also for the government, if the government is going to put limits on what doctors can do this and how they can do it, they're going to have to also put time and money into enforcing those rules. So a lot of complexity is coming down the pike.
How competitive a dynamic do you see evolving between private and public?
Well, I think that when we think of competition, sometimes it's used in a good way that competition breeds innovation or price competition. But I think the kind of competition we're going to see here is negative competition, in that you have this finite pool of health professionals with a finite amount of time, and if they're being pulled into the private system because it's more lucrative, because the patients have less complex medical needs, then you'll have this competition competition between those who can pay and those who can't pay.
How do you see this policy shift hitting the radar where the Canada Health Act is concerned?
Yeah, so with respect to the Canada Health Act, if you read the legislation, there are some parts where the Alberta government clearly tried to address the Canada Health Act. So, for example, doctors can't both bill the public system and charge patients on top of that, which is a clear prohibition in the Canada Health Act. But the Canada Health Act also more generally protects accessibility. And accessibility is defined as being able to access insured services without financial barriers. And potentially, we don't know how this is going to play out yet, but potentially we could end up in a situation where people are facing financial barriers to care, either pay or wait. And so I could see the federal government certainly getting engaged, potentially even withholding money from Alberta, depending how this plays out.
How much of a path does this pave toward an American-style healthcare system? Does it open a door to healthcare corporations moving into the province?
Well, potentially. Certainly, the government under Premier Kenney already cracked the door a little bit by allowing for private delivery of health services in a way that the government is paying, but that those who are delivering them are potentially private corporations who can then bill the government. So the door was already cracked then. I think this opens the crack further, because there's a lot of discussion about people paying out of pocket, but I wonder if a private insurance industry isn't going to evolve. And then I think we are likely to see some of the problems from the U.S. I think we're likely to see health equity, the gap between the healthy and the sick, who are also often the wealthy and the not. I think that gap is likely to increase. And then I think we're also going to see administrative costs go up. And the U.S., of course, spends tremendous amount of money on administering their system. So I think we will see some of those American problems start to turn up in Canada.
Okay, and maybe just to finish on one of those points there is then a likelihood Albertans are going to need to invest in health insurance in much the way Americans do. Is that on the horizon?
We may see a market for private insurance evolve in the province. Right now, the only private insurance there is really for services that are outside of the public system, like dental, like drugs. But we could potentially see an insurance market emerge for some of those medically necessary services within the public system that currently there isn't a market for. And so it'll be interesting to see how some of those big health insurers that exist in Canada already, but that also exist outside of Canada, may respond to these changes.
All right, we'll have to leave it there for time. As always, appreciate your time, Dr. Hardcastle. Thank you kindly.
Thank you for having me.
Lorian Hardcastle is an associate professor in the Faculty of Law and Cummings School of Medicine at the University of Calgary.